Hello, good afternoon. I'm Dr. Sanjay Mody, the Director of Healthcare Concierge. Today we're joined by Mr. Inderpaul Birdi, who's the Director of Keyhole Heart Clinic.
Good morning, Sanjay. Very nice to be here.
Wonderful, lovely to see you, Inder. Thank you for coming to the show.
Pleasure.
You know, I'm just recently back from a wonderful trip to Lagos where I have to say the food was absolutely superb. The catfish was like something I'd never tasted before. But some of the conversations and concerns which came out pertain to a growing epidemic of diabetes, hypertension and obesity. So the question which I'd like for you to consider would be, if one was to present with either of the three or the constellation together, would they also be presenting with a risk factor for any cardiovascular disease?
Well, Sanjay, these three risk factors are probably the commonest risk factors in the world for the development of cardiovascular disease. And you know, the sad fact about these three disease parameters is that they can all be treated very effectively or avoided very effectively. Now, by that I mean people with high blood pressure need to know about it first so that we can treat it with very effective medications and take away the risk of high blood pressure in the long term. Individuals with obesity, well, there's a huge amount of education and training that needs to go into learning how to eat properly. It's not just about exercise, it's about controlling our diets, not necessarily controlling our calorific intake, but controlling the kinds of food we eat in order to make sure that obesity isn't something that we are stuck with as we get older usually. And then of course diabetes, certainly type 2 diabetes, the sorts of diabetes that you develop as you get older, are in many ways related to our diet and obesity, and it can actually, believe this or not, be treated and cured in very large populations of individuals if we address that problem early.
Well, you know, have you had much experience in Harley Street in London with patients from Nigeria in Africa?
Well, we do get a lot of patients with cardiovascular disease that affects the heart arteries, a very common condition that creates chest pain like angina or even heart attacks. But we also get a lot of patients with heart valve disorders, and often these heart valve disorders have presented to the local doctors very late. And one of the very big projects that I've been involved in the United Kingdom is to educate doctors and patients to understand that they can harbour very important heart valve problems that may just be murmurs in the first instance, little noises that we can hear using a stethoscope that we place on the heart. And by picking up those murmurs early and knowing those murmurs exist, understanding those murmurs and what they relate to in terms of the types of heart valve disorders that create those murmurs, we can follow those patients up and ensure that at the right time in their lives, if required, treatment can be instituted before they develop some of the long-term disadvantages of valve disorders.
What would be the process of an individual who's in Nigeria to then come to London for a heart screen?
Well, there are many opportunities for patients to connect with doctors in the locality. The Keyhole Heart Clinic works at the Harley Street Clinic, and we know that the Harley Street district has the highest concentration of fellows of the Royal College of Surgeons and Physicians than anywhere else in the UK or in the world for that matter. And so we have to hand all of the specialties, the best individuals in every single discipline that one can consider in the United Kingdom. And so we're able to address a number of different disorders. But from a cardiovascular perspective, it's a simple case of dropping us a line at the clinic, and we can make arrangements for either a remote screen or a screen in London. And of course there are the other advantages of being in London. It's a fantastic place to visit and a lovely shopping district too.
Wonderful. Mr. Inderpaul Birdi, thank you ever so much for joining us on the show today.
Pleasure.